Hello everyone, myself Dr. Amit Kamte. Today we are discussing about IVF for special cases. You know, when the patient comes to the OPD, IVF is not a simple procedure. Each patient is a different and demand for the treatment are different. So there are few patients who are special. They require IVF with the assistance of medical help and sometimes surgical help so that we can give a good outcome for this patient. Last time we discussed about the IVF for special case. I told you the one is for the IVF with the egg or sperm donation. The patient who has absent of sperms or there are no sperms, even the testes there are no sperms, then we prefer the patient to give a sperm with the donation, which is called as sperm donor, and we take it from the donor bank. Similarly, women who has very low eggs or who don't have an egg, for them also we give the option of donor eggs, which are we get it from the donor bank. These both can be helpful for them to achieve the pregnancy and get a good success with the IVF. Second point is the IVF with the surrogacy. Some patient, especially women who has a uterine abnormality or uterus is defective or they have the recurrent pregnancy loss even after the IVF, or they have a medical condition where they can't carry a pregnancy till 9 months. In these cases, we give the option of surrogacy, which has some legal implications. With the legal help and with the proper surrogacy process, we help them to achieve a pregnancy and they can become a parent with this process. Third point is the IVF with the advanced age. Both male and female, especially female who are above 30 or 35 years of age and male who are above 39 or 40 years of age, leads to the changes in their egg quality and sperm quality, which leads to more abortion rate and give a low success in IVF. With the help of the pre-implantation genetic diagnosis and few medicines, we help them with the special care so that they can achieve a good successful pregnancy. Fourth is a IVF for a PCOS. You know, around 30% of females suffer with the PCO nowadays. So IVF is a boon for this female because in a PCOS condition, there is a hormonal imbalance. With the IVF treatment, we can help them to get a good quality embryo, and balancing their hormone, we help them to achieve good success in IVF, even they are the PCOS with hormonally imbalance. Fifth is a IVF for the endometriosis. Endometriosis is a condition where the patient has an endometrium which grow outside their uterus, leads to severe pain during the menstrual cycle and some other symptoms like vomiting and sometimes the bloody discharge. Then in this condition, the fertility impacts and leads to the infertility because of inflammation and damaging the tubes from inside sometimes. In this condition, IVF is helpful because where we take the eggs and create the babies and we put some medicines to the patient and injection so that we can reduce their endometriosis, and sometimes we operate on the endometriosis and decrease the inflammation in the body so that they can become fertile, and we plant the embryos inside and give them a better chance to become a parent. Sixth is a IVF for a male who has a low sperm count. Oligospermia is a condition where the sperm counts are less than 20, and sometimes the patient who has a severe oligospermia. In these cases, the ICSI, which is the intracytoplasmic sperm induction technique, where we take one sperm, inject into the ovary and create a baby inside the laboratory. That can be helpful for them. And patient who has a azoospermia, which is the obstructive type, where there are no sperms in a semen but testes is still producing the sperm, we use a technology called a TESE or micro TESE, which is a testicular aspiration technique, where we take the sperm directly from the testes and give a better success for a patient to achieve their own genetically baby. Seventh is the IVF for genetic disorder. There are few genetic disorders like thalassemia, sickle cell anemia, which runs in a family. So it is IVF is boon for you because there is a PGT process which is called as pre-implantation genetic testing, where you can genetically screen the embryos and choose a good healthy embryo to transfer in your uterus so that you can eliminate that diseases from your family. Eighth is a IVF for recurrent pregnancy loss. Recurrent pregnancy loss is a condition where female about 2 or more pregnancies in their pregnancy history, where the babies she can't continue till 9 months. In this condition, we can help them with the IVF because we can do a genetic screening for the babies and where we can select the chromosomally fit baby for the good success of IVF. Similarly, there are few medicines which can help the patient to treat their autoimmune diseases or other screening condition which can lead them for the recurrent pregnancy loss can be planned during IVF pregnancy so that they become a parent. Every fertility journey is unique, every patient is a different. At Nakshatra, we provide them a customized service so that they can become a parent and have the happy family. So kindly subscribe our channel and visit Nakshatra Fertility Clinic, Balewadi, Pune.